Kia ora. My name is Jo Wailling. I'm a research fellow and facilitator at the Centre for Restorative Justice at Victoria University of Wellington, and I'm going to talk for 3 minutes about restorative inquiry, a resilient response to systemic harm. So our understanding of the expression of resilient performance in the aftermath of harm is limited because of the focus on factors that contribute to safer healthcare most of the time. So why is knowledge of immediate harm responses important? Well, imagine for one moment that you suffer devastating impacts from surgery that are so bad that your entire life is changed. You're told, we're sorry, you're one of the unlucky ones. We will investigate and come back to you in time, and we promise we will learn from your incident so it doesn't happen to anybody else. Well, the experiences of surgical mesh survivors told in inquiries all over the world mirror the evidence, which tells us that pre-scripted regulatory and procedural responses often compound the harm experience for all of the people involved. So can we imagine a response that mobilises system resilience capacity? Well, I think we can. And in New Zealand, we co-designed a restorative response to harm from surgical mesh use with patient advocates and also with the Ministry of Health. So a restorative response, in case you haven't heard of it, it's founded on relational values and principles. It uses dialogical practices, and it's guided by the concern to address harms, meet needs, restore trust and promote healing alongside learning. It's a relational approach, and we used it to listen and to understand the needs of the people affected, co-produce a meaningful response, and also establish responsibility for ongoing action. And our evaluation concluded that the project met most people's needs, patients, families, clinicians, and those responsible for repair and prevention during the listening phase of the project, and should be provided alongside existing regulatory structures, policies, and procedures in New Zealand. But what does the resilience lens illuminate? Well, here are my top 4. First of all, if we anticipate that harm will occur to relationships, we can mitigate it by promoting well-being and a sense of community by fortifying relationships. So, for example, in the co-design process, use of proactive restorative practices provided relational slack, and it provided a buffer when conflict subsequently occurred. Secondly, even in the aftermath of severe harm and human suffering, the potential for adaptation, learning, and growth can and indeed must emerge from relational connection and co-production. For example, we found emergent social networks that the harm patients had created actually scaffolded the health system with essential resources during a period of isolation and severe trauma. Thirdly, a restorative response supports adaptive capacity. So the continuous assessment of people's needs throughout the project allowed the programme to adapt. For example, we changed our approach in order to support people to tell their story to whom, when, and as frequently as they wished, which awarded dignity to the experience of recovery and also supported the well-being of the people that were listening. So finally, we can learn about safety by socially connecting in the emotion of compassionate dialogue. And this was reported as a really powerful intrinsic motivator that's already resulted in change. So in conclusion, restorative inquiry produces resilient performance and is essential in the aftermath of harm. Thanks very much.